So we're back with Miss Barton. Miss Barton, I saw you saw the video that we had of the Antietam battlefield, and we're here with Lindsay Royal, one of the nursing students, who's going to finish part of the interview with you, if you don't mind.
Yes, thank you, Daniel. The video brought me back, and I went into my closet and I found this old apron that I used to wear from the American Red Cross, and I decided to put it on for the rest of the interview, if that's okay.
Yes, it's very lovely.
Thank you.
I had a few questions for you. Throughout the Civil War, you were very involved on and off the battlefield. What were your major contributions to the Civil War?
Well, I worked mostly in the Maryland and Virginia area, and I did nursing, but my contributions were not primarily as a nurse. In 1861, soldiers from Massachusetts had lost many of their belongings in an altercation. I decided to work to provide supplies for these troops. The Surgeon General allowed me to personally distribute supplies to wounded and sick soldiers. I also personally cared for those who needed nursing services. I started to do this and travel, and eventually I became a superintendent of nurses.
Oh wow, so you had a lot of autonomy?
Yes, I really didn't have a lot of supervision, and at this time I wasn't part of an organization. I would organize the delivery of supplies, fill up the wagons, and bring them to the hospitals and battlefields. And after time, I began to identify the dead and wounded so that their family members could know what happened to their loved ones. I always remained neutral, working with both sides.
They called you the angel of the battlefield. When the Civil War ended, you continued your work with the missing, wounded, and deceased soldiers. A national cemetery was established for these soldiers in Georgia with your help. You also worked in D.C. to help identify more of the missing. As a woman during this time, tell us how working on and off the battlefields impacted you and other women.
Well, long before I began to work in the battlefields, I helped to open a very successful free school. I taught there for 18 years and resigned. They decided that the school should be headed by a man, not a woman. I found another passion helping those on the battlefield. When the Civil War ended, President Lincoln supported me and I became head of a missing persons office. I was the first Bureau women's head in the U.S. government. And I wasn't quiet about what I experienced. I began to lecture widely about my war experience. I didn't get involved in women's rights organizations, but I did speak for the campaign Women's Suffrage, which ended up winning the vote for women.
In 1866, the Geneva Convention was established, and through this, the International Red Cross. The Red Cross began and still is a voluntary movement to carry out humanitarian work in the face of disaster and comfort and without discrimination. We know you held an active part in establishing a lasting Red Cross society in America. Tell us more about this major contribution.
Well, about 3 years after the Geneva Convention was established, I was in Europe for my own health reasons. I first heard of the Red Cross and became involved in delivering sanitary supplies to different venues. I stayed in Europe for about 4 years and returned to the United States, and I worked to ratify the Geneva Convention and establish a U.S. Red Cross affiliate. I became the first president of the organization, and I did this for just about 23 years.
Oh, wow. Was there anything different about the American Red Cross? Were you able to use what you learned in Europe and adapt it to the U.S.?
Yes. The American Association of the Red Cross was created to serve America in peace and war during times of disaster and natural calamity. I took its service beyond that of the International Red Cross movement by adding disaster relief to battlefield assistance.
Claire, throughout the Civil War, were you very involved on and off the battlefield?
Okay.
Oh, well, I guess Claire's done with Lindsay, so I'm going to let her transition over to Lisa's questions. Miss Barton, Lisa's one of our last nursing students. She's going to do some questions as well.
Bye, Lindsay. Oh, so nice. Thank you. You're so sweet.
Hello, Miss
Hi.
Barton. My name
Hello.
is Lisa. How are you?
I'm good. Thank you. Thank you.
Good. Well, I know you've been doing a lot of talking now, so I just thought I would let you know about the American Red Cross and what a major ongoing influence it still has in society
Good.
today.
I was wondering what is going on.
Today, the Red Cross has over 1 million volunteers and 30,000 employees that aid people that are affected by all types of disasters. They are the largest suppliers of blood and blood products to hospitals and communities. They provide tissue for transplants. They're involved with cellular therapies that help prevent disease and aging process. They invested over $25 million to the Jerome H. Holland Blood Laboratory, that's in Rockville, Maryland,
Wow.
for research activities. They also have a huge, important education branch. They provide programs in CPR instruction, first aid instruction, babysitting, water safety, lifeguarding. Their international branch also has health initiatives which focus on infectious diseases like HIV, AIDS, and measles. They provide technical and financial support to communities for vaccinations and disease prevention. So as you can see there, your organization that you created has changed and helped the lives of millions of people in the country.
Wonderful. That just sounds so wonderful, Lisa.
Not to mention your school that you established in New Jersey, and also your diabetes camp that you have in Massachusetts that helps families with children that have diabetes.
Good. It's wonderful. It's just wonderful.
Did you ever think that it would be so large?
I did not. I didn't, and I'm so happy to hear that the American Red Cross is still helping us in times of natural disaster.
Speaking in times of natural disaster, we have a hurricane around the bend, so I'm glad that the American Red Cross is there.
Well, doesn't that leaves you feeling good knowing that they're there for you in times of natural disaster?
Absolutely. Now stay tuned for some fun facts about Clara Barton.